Sam, I think we can start.
Perfect. Thank you so much, Kuzi, and good morning to you all. Um, Thank you for taking time on a rainy Thursday morning to come and join this webinar. As Kuzi said, we'll jump straight into it. We have about 45 minutes, so we intend to be done at about 10:45. I'm hoping to be speaking for 43 minutes of that so that I only give you 2 minutes of questions. I'm only joking. So hopefully I should be done at about 35 minutes so that we can jump straight into the questions. Please feel free to utilize the chat. As you know, to those who know me, I'd like to present with you guys. So please do feel free to use the chat so that I know A, people are not sleeping and people are actually paying attention. So as we are getting started, if maybe you can just drop a hi and where you're joining us from in the chat, that would be really, really appreciated so that I can just see who we are with today. So just a hi and where you're joining us from this morning. Again, so that we just make sure that everyone knows where the chat box is as well. Then I will get started. To those who are joining us, good morning. We're just about to get started. Because I don't know if you can see anything in the chat, if it's working or not.
Nothing yet in the chat at the moment. Maybe people are still warming up, but as soon as something
Perfect.
comes up, I will definitely let you know.
Super. Thank you. I think we'll get started with all the chat then.
Okay, good.
Since people are warming up. Perfect. Super. Now, in terms of who we are, so as my colleague could introduce me, my name is Samuel Chinya, and I'm here on behalf of Blue Hectare. Blue Hectare is an accounting firm that specializes within the health and social care sector. So we assist you with all your accounting, payroll, and tax needs. I'm not going to spend too much time on this because I want us to focus on what we are here for. Now, pricing, costing. I'm sure we know how important it is in this sector, and especially around dom care, home care, when we go for tenders. I love this quote from Catherine Payne, which basically says, the moment you make a mistake in pricing, you're eating into your reputation or your profits. So effectively, if we get pricing wrong, you're going to eat into your reputation or your profits. I know today's topic is simple, but it's a very critical one. And I'm just curious to pose to each and every one of us who's here. Do you actually know what each hour of care costs your business? Is this something that we're actually confident we know what each hour of care costs our business? This is the part normally because I would ask people to give us a yes or no in the chat, but as we have a tough crowd this morning, I am going to skip that and I will just proceed. Um, as specialist accountants within the sector, we find ourselves reading and researching, particularly in this field. And on my screen here, you're just seeing, I think, from the Home Care Association, they published a minimum price for home care, 26.27. And what you see on the screen, £34.42, is what they say is a sustainable amount that a provider should be receiving for every hour of care that is administered in the home care / dom care sector. Now, the point of the webinar today is not to go out to the councils and start to demand 3442. No, this is not what we are here. But I want us to understand how they arrived at 3442 so that we can apply that in our own organizations. Looking at the 3442, we also know that councils are very notorious for paying late and for paying under. I think according to the 25-26 publication, on average, councils paid £24.10. Compare that versus the 34.42, you can see that there's almost about a £10 gap between what is regarded as a sustainable amount versus what councils are actually paying. Now, I have purposefully left the amount of councils who are paying below average as empty, again, because we know which councils we deal with and we know how much we're getting paid by our councils for the service that we render. This is again where you come across providers who are willing to take a low offer, undercut themselves to get their foot in, not again paying attention to the consequences and the impact that that might have on the business. Again, Birmingham Council recently published their figures for 25-26, where they were saying that the annual rate has now increased after the uplift to about £23.35. That's Birmingham City Council, and I just found that a bit interesting to say the least. Moving on, how is the £34.42 broken down? The minimum price or the sustainable price that is given, excuse me, by the Home Care Association. And I think this is where I want us to really draw attention to, and this is what I want us to at least take away from this webinar. Now, when we go for a tender or when we price a tender and we are paid, in this instance, the example that we're using in this webinar is that £34.42. That £34.42 can be broken down to different segments. And I'm sure as you apply for tenders, you know, because some of the tenders ask you to break down. They ask you to break down simply how much are you paying your employees, how much of that is going towards your NI pension training, mileage, business costs, and any other costs before they even ask you sometimes at the bottom to state what your profit figure is going to be. This is really important, and it is really important that we understand this. Now, keeping our carer wage or support worker wage at 12.71, which is the minimum rate, you can see that takes up a good chunk of the 34.42 that we get. But this is not the care worker cost, because I'm sure you know, as an employer, there are additional costs that come on top of this fee or wage, if we can call it, that you have to pay for. Things like employer pension, employer NI, and also factoring in holidays. When you factor in those calculations, you actually see that you move swiftly from that 1271. You add your employer NIC pension, excuse me, you also add your holiday pay, statutory sick pay, as well as travel time and mileage, which is, I know, a very contentious subject on travel time and mileage. You can slowly see that actually one employee is costing you to the tune of 1271 plus 621. You're looking at almost £19 before you start to take into account any overheads, travel time, or a profit that you make. Now, if you know one employee is costing me £19, you then need to factor in things like travel time and mileage. And I know this is, again, I hear this from a lot of providers when they say councils don't even pay me for travel time, yet I'm still expected to pay for travel time. And I'm sure to those who have COS employees, you know how sensitive this area is, because travel time has to be paid at least at national minimum wage level, 1271. Otherwise, you're in breach of underpaying your employees. When you factor that in, as well as the travel time, mileage as well, between the calls that you have, you actually see that cost creep up to almost £21 before you factor in your overheads and you start to make a profit. Hopefully, that is just painting a picture of the true cost of actually providing care. I Okay, it depends on what you pay in your organization, but for the carers cost, you see that these are broadly aligned across all the businesses. What do I mean by that? Employers NI is 15% for everyone. The only thing that changes is the rate that you're paying. Are you paying 1271 minimum wage, or are you paying more? If it's more, then it's that times the 15% to calculate this for you. You need to get a good picture and a good understanding of this for your business. Now, I'll quickly just touch on management and overhead cost, because again, this is another area where if our businesses do not have financial records, we don't know how much in overheads we're spending each month or each year. As a result, again, it impacts our ability to be able to price or to do costings effectively. I've already touched on some of this, but again, I will just come back to it to give it a bit more flesh, if I may. We spoke about your carer basic pay. This is the minimum wage 1271 or whatever rate you're paying your employees. You need to factor in your employer NIC, your pension contribution, which is 3%, holiday pay, unplanned absence cover, travel time, and mileage. All these costs make up what we call your care worker costs. Again, this is effectively what it's costing you to supply a care worker or a support worker to do an hour of work each day. Again, before you start to make a profit. Now, you might ask, why is it important to know this figure? It's important to know this figure should, again, a tender for, ridiculous example, 20, 21 pounds become available. You know you can't take that because you're not going to be profitable. You're going to be in a loss-making situation. Why? Because for your carer, you are effectively, it's costing the business 20, 21 pounds before you even add on the overheads and the profit margin. So already you have that rough slash indicative figure of, you know what, any tender or any work that is below a certain X amount, I am not going to take that because of how your organization is set up. Now, from the care worker cost, of course, we spoke of the business overheads. So these are effectively your fixed costs. So things like your registered manager, your finance slash accounting fees, excuse me, things that you have to do for the day-to-day running of the business. Again, you see that the fee that you get paid by the councils need to contribute towards that in order for you to be able to make a profit or a loss. What we actually see most of the times is there are some costs that providers do not include or fail to include when they do their costings slash pricings, especially as they go for tenders and contracts. So I'm just going to touch on a few here. They are not all of them because of time, of course, but effectively, I just want to draw attention to non-contact time. So this is effectively time where your employee is not with the service user, non-contact time. This could be travel, handover, training, care plan review, or just basically waiting time, effectively. You still need to pay your employee for this time because they are within your business and they're actually working, and they need to be paid at least national minimum wage. Now, factoring in this time to pay your employee will increase the cost of the business, ultimately eating into those profit margins that we saw. What you tend to see is if you have a lot of travel time, a lot of handover, or a lot of non-contact time that your employees are involved in, the council is not paying you for that time. Put it simply, because that council only pays you for contact time. Now you have to somehow foot that bill, i.e., make sure that your employee is paid on that time. So you really, really need to be mindful of the non-contact time that your employees have, and also the implication that you have on the profitability of the business. Staff turnover, I'm sure we all know this by now, that high staff turnover is expensive. The amount it costs you to recruit, to train staff, and to make sure that they're fully embedded within the systems of your organization. It's a lot of money. If you're not retaining your staff well and you are experiencing a high staff turnover, it's going to be expensive for you in the long run of the business. And again, eating into some of those profit margins that we are talking about. Um, Volume. Now, I know there's this conception of, you know what, the rate is not great, but if I have a lot of hours, then it makes it worth it. Unfortunately, that is not true because volume does not fix the margins. If you're making a loss on 1 hour, you still make a loss on 10,000 hours if nothing changes. I'll repeat that. If you're making a loss on 1 hour, even if they give you 10,000 or 20,000 hours, you still make a loss, provided everything is operating the same. So it's one of those where you are busy, but then you have nothing to show for the business that you're having. I'm sure you know the headaches that come with managing home care slash dom care, the constant cancellations that might occur and the cover ups that are needed. And imagine that was juggling a high volume, and yet at the end of the week, at the end of the month, you have no profitability or anything to show against that. So I just want to draw your attention that if 1 hour is not profitable, please don't be tempted in accepting 3,000 or 5,000 because they will still not be profitable until we address the fundamentals of why that 1 hour of care is not profitable. Of course, we can talk of mileage, which I'm sure you know the rate has been increased from 45p to 55p, which is optional to pay. So you can choose to pay this, or you can choose for your employees to claim this directly from the government website. Up to you as an employer and the policies that you have. But these are some of the things that actually come in and eat into that profit margin that we're talking about. And I just wanted to hopefully bring some attention and some life to some of these that we actually just keep a close eye on them, put simply. We then come to one of my favorite tabs, which is basically just saying, what is that number for you that you need to accept or decline, if I can put it that way? What is that magic number for you that you know, if I accept a contract at this rate, I am breaking even. I am not running a loss, nor am I making a profit. What is that number for your business? Now, why is that number important? That number is important because it means that all your variable costs and your fixed costs are covered, i.e., even though you're not profitable, you have covered your expenses. So now you know anything above that number is pushing you towards that profitability margin. And I will just step back and explain it a bit further effectively. When you talk of fixed costs within your organization, these are costs that are there irregardless of how many hours of care you provide. So whether you've done 0 hours or 1,000 hours, these costs remain. These costs normally are your, for example, office rent. You have to pay your office rent, regardless of whether your employees have worked or not. That is not changing. Your insurance, software costs, and also, if I'm cheeky there, I can even add your accountant who pay us whether you've done work or not. It is what we call your fixed costs. So costs that are there, regardless of whether you've done an hour of care or not. Then we have variable costs. Now, these are costs that move according to the volume of work that you have done. So for instance, if your carer does more hours, you know you have to pay them more. And in turn, your NI, pension, travel time, etc. will be as a result on a sliding scale of how many hours that they have done. So fixed costs don't change. They are there regardless you work or not. Variable costs, you incur them based on the work that you have done. Now, the danger is if your price is slightly above variable costs, you then need huge volumes to cover your fixed costs. I'll repeat that. If the tender or the price that the consoles are paying you is just slightly above your variable costs, you would then need huge volumes in order for you just to break even. And this is the worked example that we see on the right hand of the screen, where we are saying, you know what, you are charging £27 per hour. Your variable cost, so basically your staff cost and the cost of you delivering care, is coming up to £22.50. There's a £4.50 gap between the fixed price, sorry, the price that you charge and the variable cost, which is what we call contribution per hour, £4.50. Now, that contribution, £4.50, is going towards the monthly fixed costs. In this instance, 12,000. So basically, if you're contributing £4.50 every hour that you work, for you to be able to break even, i.e., cover all your expenses and not make a profit, you need 2,667 hours per month just to break even. Any hour below this, you're running a loss. Any hour after this, you're starting to be profitable. Now, again, the sweet spot here is the price charged per hour. This is unique to your organization and to the contracts that you have. What is that 27 for your organization? Once we get that figure, we then need to understand what is that variable cost for your organization so that we can understand what the contribution is for your organization before we know how many hours of care you need to deliver in order for you to break even. This is an example that I think we need to adopt and apply within our organizations. By no means am I saying £4.50 is the contribution everyone should aim towards, because for some of us this number will be higher, and for some of us it will be lower. And you see that it will be different across packages as well and across councils, because some packages pay more, the complex ones, and some councils pay more by nature. And even private clients, sometimes you find that they actually pay slightly more than what councils pay. But the theory, the logic is the same. Let's understand what our fixed costs are. Let's understand what our variable costs are. Let's understand what price we are charging, i.e., we're getting paid for each hour that we are delivering, so that we understand our contribution per hour in order for us to work out our break-even point. And I'm sure we know why break-even is important. We need to be profitable in these businesses. I think recently as well, since the back end of last year, we've started to see councils requesting for accounts from providers. Councils want to see how you are performing financially in your organization. Are you profitable? Are you not? And if you are not, I am sure for those of you who have experienced something similar, they want assurances that you're not a risk to them and the service users that you're looking after. So it is really, really important that we understand our break-even point so that we can maximize on our returns and be profitable. Take some water break. So, what am I saying in a nutshell here? In a nutshell, I'm saying you need to know the true cost of you providing care. Again, this is per package slash per provider slash per company basis. It's not the same. This is not a one size fits all, because your business models are different, your business expenses are different, and even what you pay your employees is different. In order for you to understand your true cost, you need to calculate every component, not just wages. Don't just think, oh, I pay my employee 12.71, so if it's £20, great, the rest is profit. 20 minus £12.71, I'm profitable. No, it's not that. It's not just the wages that you need to be mindful of. You need to make sure that you include the on costs, which is your NI, pension, holiday pay. These costs contribute towards that care worker cost that hopefully you recall we looked at a few slides back. You need to also build in your overheads. You need to understand your overheads. How much does it cost you for your business to run? Again, what you see in care is staff costs make up the bulk of our expenses. The overheads, whilst they are there, they are not a huge proportion compared to what we pay our employees. Nonetheless, do not ignore them. You need to make sure that you build them into your costings as well. And also, please review these at least once every year at the very minimum, or every quarter. Why? Because I'm sure you know your business needs and your business expenses change. Of course, there's some that are fixed that are logged in for a year or so, but I'm sure you know providers or things, even if you look at national minimum wage, it went up from last year April to this year. In this year April, the minimum wage went up. So costs do go up. Just because the rate was profitable last year or 2 years ago when you won the tender for 4 years doesn't mean it's still profitable this year. So please make sure you are constantly reviewing those as well. The second thing that you now need to do is to set the right price. And how do you do this? How do you do this? You want to set a price that is above the floor level. What is the floor price I'm talking about here? I'm just talking about your break even. You want to make sure that your price is at least above your break even point. Why? Because we're in that sweet spot now of making a profit. And what we tend to see is this profit margin tends to be about 5 to 10%. This is what I personally would class as healthy. Of course, the more the better. I know of some businesses or some countries where the profit margin is greater than 100%, which is which is not the norm. So anything between 5 to 10%, for me, that is great. Again, make sure that every package that you have is at least giving you that profit margin, i.e., you're profitable on all packages that you're doing. You also need to have an uplift for complexity, unsociable hours, or if the travel time is r- great. If you're having to travel or have longer waiting times, again, please make sure all this is calculated into the price when you do your costings, because at the end of the day, that money is still going to come out of your pocket in order for you to be able to pay and to remain compliant. I will say this boldly. Please do not accept below your break-even point. It's frustrating and very painful when you hear providers accepting an offer just to get a foot in the door. When you hear providers ignore their true costs, wanting to submit a lower cost so that they secure the bid. Whilst I understand it from an operational point of view, because you want to work and you're thinking at this point I can take anything, but the true picture is that's going to be frustrating for you and for your employees, because now you're not going to be paid enough. You're going to have cash flow problems. Your staff are going to be demotivated. And even you're working hard, but you have nothing to show for that. So please, please, please make sure that you have known your costings and you know what you're accepting before you say yes or before you go in for bids. Sustainable pricing, you are effectively making sure that your workforce and your business is suitable. Again, I spoke of councils wanting to see your financial performance now in order for you to keep you on the framework. So you need to make sure at least you're profitable for the going concern so that your business continues to operate. You need to also make sure that you're looking after your staff in terms of trainings, the Christmas lunches or the meals, etc. Those are nice to haves that you can't afford to do if you're not making a profit, because there's no resources to be able to allocate for that. But you see that if your pricing is right, you then can do that, and you'll be amazed at the return that also it brings back from your employees as well. And also, you need to be able to absorb cost, because I'm sure you know sometimes prices can just go up, be it from your rotoring provider system. They've done a price increase. If a price increase can't be absorbed, which means you have already fallen from profitable to loss. So you always might want to make sure that you at least have that buffer to say, you know what, if costs go up by at least X, I'm still covered. Anything outside of that, then maybe the conversation needs to change, and then you need to approach the councils or the people you work with to renegotiate a rate. Now, what are we just saying here? We're saying basically calculate your full loaded cost before you submit a tender so that you fully understand how much that package is going to cost you, so that you know whether you're going to be profitable or not. You need to identify the fixed cost base of your organization and for the contracts that you are taking. Again, we already touched on the floor price and the break even. Again, we need to see if you don't get a uplift from the council, which I think is the norm in the few years we've been running in this sector. Uplifts are not always given, because I'm sure some tenders, when you win it, they'll tell you this tender's for 4 years and this is what you're getting. Uplifts are discretionary. It's not a given that you're going to get an uplift every year. What would that look like for you when effectively, let's say, for instance, minimum wage goes up every year for the 4 years that you have that contract? Would that still be profitable? Or do you need to make sure that you negotiate a rate that is higher from the onset when you get there? So these are some of the things that, again, you just need to make sure you are on the lookout for. Again, when we look on red flags in contracts, fixed rates with no uplift. I think in this day and age, that is not a great contract, because I'm sure you can see living pressures that are happening in the world. The cost of living is constantly increasing. National minimum wage has literally just been going on year. So you know your business expenses are going to improve. And if your income stays the same, then it's going to give pressures to your operations. Again, please be mindful of the travel time. This is the again, one of those areas that is of high contention within the sector. Travel time. If your carers are having to travel loads between calls, the council is not paying you for this, and it's effectively just eating into your margins, especially if you've not priced it well when you submitted the contract, when you submitted the bid. And this is now where you start to not want to pay travel time, and then you start to put your business at risk because you're paying below national minimum wage. It puts your COS license in jeopardy, and I'm sure you know the things that literally spiral on top of that. For the council rate, again, this needs to be specific to you guys. I know here I say 27, but understand your business, understand your overheads, understand your cost, understand what that minimum rate is for your business. I've just put 27 here for illustrative purposes. Understand what that number is, and please don't accept anything that is less than that. Understand what it is so that you know, okay, you know what, any business below this, I can't afford to take it. But anything after that, then you're in the profitable range that we are looking at and that we effectively love. This is just a quick summary of some of the key figures that I just want you to be very mindful of. So I'm sure we now know that the minimum wage has gone up to £12.71. Of course, I know for COS staff slightly different, so please do make sure that you're at least complying with that. You need to pay your employees at least national minimum wage. The rate of employer NIC, 15%. You also get the NIC threshold of 5,000, and your minimum pension contribution is 3%. For those of your employees who have opted in, you need to pay at least 3%. Again, all these are additional costs to the business, as we said. Please be mindful of the holiday entitlement. It's also a cost to the business. I know I said £32.14 Home Care Association. This was for the previous year. Current year, that's the 34.42. But make sure you understand what that number is for your business, please. Make sure you know. Before you even go and start to write these tenders, make sure you know what that number is for you. Annual staff turnover in care is very high. Please look after your staff so that at least you can minimize the pressures of some of these costs that we are talking about. And also sickness, absence. I know you know from the 1st of April the change in sick pay, which effectively from day one you need to pay. That's an additional cost to the business. Again, please just make sure that you are familiar with these things. Now, as we conclude, what's our action plan? This week, if we can list every component, i.e. the cost of our business, so that we can calculate that variable cost that I spoke about. Please let's go away and calculate that. Again, as your accountants or from your accountants, we're here to help. Reach out to your accountants and they can help you price this. Like I said, it can be per contract, depending on which contracts you're servicing, per council, depending on which councils you're servicing. Make sure you understand that, again, so that you know if your packages are still profitable or not. Also, identify your monthly fixed cost. What is that number? This is where having an accounting system that is kept up to date helps, because those numbers can be derived from your system in a click of a button. Once you understand that, it makes it easier for us now and for you to build your cost model so that when you're going for tenders, you're confident in what you need to be able to price your tenders at. Step number 2, let's start to practice pricing above all cost. I know for those who have mastered it, it's a no-brainer. You might think, I need to price more than my cost because this is how you make money. But for those of us who are not yet there, again, let's just start to practice it and to be bold in that. And for the contracts that we already have, let's review them. Are they still profitable? They might have been when we got them. How are they performing today in this day and age, so that at least we understand what is that. Now, once we do that, going forward, let's now keep true to what we've done. Use your cost model to price any future tenders that you will do. Don't submit tenders that are below the floor, the break even, the lowest minimum that you and your organization are prepared to accept. And for some of you, it might be you actually need to go back to councils and renegotiate an uplift. Just talk to them, show them the numbers, and effectively ask. You staying as you are means you're not going to improve if you ask and they say yes or no. No, you're still the way you are. If they say yes, great. Your business is operating a bit better. I know I was flying through that, but I believe I have kept true to the time. It's 10:35, so that it gives us about 10 minutes of questions and answers if there are any. Thank you so much. Hopefully that was very informative. I would love to hear your feedback on that as well. Thank you. Over to you, guys.
Yeah. Thank you, everyone. I think, Sam, we've only got one comment, I think, from Nyarazo, where she's talking about, I think, that I know we use minimum wage as an example, but for stuff that is on COS, it's a bit hard. If you've got any questions, please feel free to put them in the chat. Give me a second as we are just working to make sure that anyone can unmute, so you can raise your hand and then and then you can be given a chance to speak if typing is a little bit tricky. So just give me a second as we just changing the settings so that people will be able to unmute behind the scenes. But in the meantime, please feel free to put a chat in the question. Sam, I think there is one question in there. Please, if you can have a look.
Thanks, Goodzy. Yep, I can see it. So the question is, what are councils like in terms of going for an uplift? It depends, Temi. That's the honest answer on council by council, and also how important you are to them, if that makes sense. So you see that some councils would want you to justify why you're asking for an uplift, and this is where you go in with your costings to prove that, you know what, the fee that you're having is not sustainable. As a result, you'll not be able to continue to provide care. So again, once you tackle it from that angle and you prove, you show the numbers, then they can have you for that. So what you see is they'll also want to do their financial checks. Most of them, they can either send you a couple of forms to complete, or they can effectively just invite you for a meeting where they sit down and they hear your concerns. But like I said, it depends, because if your contract said there is no uplift in the contract, then they are not going to give you one sometimes, but sometimes they do. So it basically depends on council by council. Some will welcome you, give you the opportunity to express yourself before they give you a feedback on that.
Yeah, there's another person typing, I think, on the question. Feel free to unmute. So you can unmute and ask a question if it's easier than typing. So please feel free to unmute and ask a question. I'll wait for the people that are typing, and then Sam, we can see if we can attend to that. Whilst they're typing, I'll also put a link in the chat for our Google review page. So please leave a review of what you thought this webinar is. It just helps us to know what your thoughts are, and also helps us to make sure that we can track. So I've put in the chat there just a link for you to leave a review. So please leave a review. Louisa said, thank you very much. This has been really helpful. Thanks, Louisa. That's really good. I think there was someone else who was typing. I think it's Angeline. I'll wait for her to finish, and then we can discuss. But just reiterating what Sam has said again, I think costings form a very important part of your business, and please don't take it lightly, or don't go blind when you are going into tenders. Even if you know that the margins are low, but go knowing what the numbers are. This will also help you to know what is the minimum amount of hours that you need, what is your contribution rate, and the effort that we need to make sure that you do that. Sam, there's a question there from Angeline.
Thanks, Kizzy. So the question reads, councils are struggling with budget cuts and therefore offer rates that are low. Because we are many providers in the market, it's difficult to get a higher rate than what is being offered. What do you suggest we do to maximize the rates on offer? Where can we reduce costs? Angeline, this is really simple. Please get in touch with us and we'll offer you a free financial health check where we can go through your numbers and see areas in which we can reduce cost. Hopefully that answers that.
That's good. And also maybe just to add to what Angeline is saying, what we notice, Angeline, with most people is most people don't keep records. So even if you want to reduce costs, if you do not have an accounting system where you're keeping records, then effectively you don't know. You don't know whether you're being profitable or not. You're flying blind. So which I think is very dangerous. So like what Sam said, Angeline, if you get in touch, we can definitely help you. Just run a simple free health check and be able to do that. But the key thing is to keep proper good business records. Make sure that your bookkeeping is done on time. If your bookkeeping is done on time, then you can pretty much review this on a month-by-month basis to see, okay, fine, how many hours did I do? How much did it cost me? What do I need what do I need to improve, or where can I cut costs, especially with the overheads, because you see that with staff costs it's difficult to cut over there. It boils down to overheads to see, okay, fine, what can I reduce? Do I need two offices? Can I go for a cheaper supplier for certain products? So it's those decisions that needs to be made constantly to make sure that you pretty much are on top of your overheads. So yep, yeah, I'll put the link in there. What I might do is I might pin it so that everyone can have a look. So I pinned it at the top there. Please feel free to leave us a review. I think there was someone else typing some. We've still got about 3 minutes or so before we finish. If you've got more questions, please feel free to unmute and just ask. Yes, Mr. Manuel.
Hi, Kudi. Hi, Sam. It's not Mr. Manoa, it's me, Mrs. Manoa.
How are you?
Good, I'm good, thanks. And thank you so much for your webinars. I think they're very informative. I just wanted to make a comment on the work that you're doing, and just to let everybody who is on this platform that it is very difficult at the moment in the care sector business, that the councils and the NHS, they are not willing to pay, especially what Sam has just calculated on the £34 an hour. I'll give an example. In Reading, we work with Thames Valley ICB, and they don't even want to know most of the things like the overheads and stuff like that. They don't want to know. They just want to know the rate that you're going to be paying the people and all that. So it's a struggle. It's just a comment that I just wanted to make, that 34, it's difficult to get, especially in West Berkshire. Yeah, even the uplifts as well, it's a struggle, and they don't want to know, or they'll take their time, and it's difficult. So I just wanted to reassure everybody who's on this platform that it is a struggle at the moment, and I don't know where we're going as health and social care in terms of business. Thank you.
Thank
Yeah,
you so
no,
much for
thank you so much. Yes,
Sam.
Sam, please go
No,
ahead,
I was
Sam.
just gonna echo the same sentiments, because say thank you so much for highlighting that, and you are so right. It's tough out there, and it's a real struggle. And to add to the pressures, you then have Home Office coming in for inspections
with
as well.
with the higher rate.
Exactly. So yeah, it's very tough. The things that we can control, let's make sure that at least we're doing them well.
You've got the Home Office, and then you've got the HMRC as well, who's coming. You've got the CQC. So it's
Please
tough.
don't mention the pay.
No, it's good. Yeah, we've got about a minute left for questions. So if you've got any questions, again, please feel free to unmute and ask. There's a thank you from Angeline. Yeah, you're welcome. That's good. Yeah. So please keep an eye on our social media feed on Facebook. We're on LinkedIn and Instagram as well. We will try to drop a webinar once every month, at least once every month. I think there are some months that we've actually managed to drop two webinars in the month. The key is to try to help you as businesses, health and social care providers, so that you know what, you're as informed as much as possible. And I think as Blue Hectare, we specialize in health and social care businesses. So anything around those area, it's our job, or maybe we feel that it's our responsibility to make sure that providers are as equipped as possible and as informed as possible. The next webinar, we're still deciding on a topic. So if you've got a topic that you feel you want to discuss, please can you put it in the chat now before we finish? So if you know that there's a topic that you want us to cover, feel free to put it in the chat. There's one hand from Nyarazo. I'll let Nyarazo speak whilst people are typing topics which they want us to discuss next. So if there's a topic that you want to know, please put in the chat and we'll try to help. Nyarazo, please go ahead.
Yes, just to remind our audience that Blue Hectare will be presenting on Turn Law Solicitors webinar chat on the 25th of June on the topic of mileage and travel time payments. So I'm sure it affects. This platform is for TANLO solicitors, but if you belong to Blue Hectare, you're more than welcome to join this platform. So login details will be sent in due course.
Oh, no, no, that's great. That's great. Thanks, Nyarazo. Sorry, I think I'd kind of skipped that one. Yeah. So what we'll do is I think if you're one of our clients, when we send the monthly newsletter, you get the links or the details on how to join that one. So that one will be on the 25th of June. Or talking on mileage and travel allowance. I think there's a comment from Temi before we finish. Is it possible to get self-employed support workers, carers, whether they sort out their own taxes and the streamline help? I will probably say so. Technically, yes, but it's very, very difficult because, as you know, I think, which has been highlighted earlier here, most of the stuff that we get for in the healthcare space are pretty much coming through sponsorship, and you can't get someone on a sponsorship to be self-employed. So if someone is local, technically it's yes, but there are other rules that you need to consider around IR35 as well, just to make sure that you're not in breach of those rules. So this will probably need to be identified on a case-by-case basis to make sure that you're able to do that. But let's say it's not a complete no, but also it's a yes with a big caveat in terms of making sure that you don't breach the IR35 rules. Thank you everyone for joining. Hopefully you find this useful. I've seen some very positive comments in the chat there. The recording will be loaded, I think, on our Facebook and YouTube, maybe sometime next week. So if you know anyone who you think they would definitely benefit from these, please keep an eye on that and then just share a link with them, and we'll take it from there. But yeah, until the next webinar, keep winning. We'll catch up soon. Bye.
Thank you. Bye bye.